Welcome everyone to the Greater Oshawa Chamber Commerce live chat. We put together this small panel here to get some information for our businesses and our community here in Oshawa and Durham region. I want to welcome Dr. Tony Stone, the Chief of Staff of Lakeridge Health, and Stephanie Miner from Mason Bennett John Cox Lawyers. We're here today to talk about COVID-19. And what is COVID-19 and what does it mean to our businesses and our community? So I'm going to jump right in. We have some questions that we have. First, we're going to start with Dr. Stone. And can you just give us an understanding of exactly what is COVID-19?
Sure. So COVID-19 is a name given to the disease that's caused by this novel coronavirus, which is called SARS coronavirus 2. And the disease is a wide spectrum. So many people who get the illness, it often starts mild, and the symptoms are similar to many other colds and flus. You can have fever, dry cough, fatigue. You can get runny nose, sore throat, muscle aches. And for 80% of people, it doesn't get any more severe than that. They might get some mild breathing symptoms, but then they clear up. But in about 1 in 6 people, 1 in 5, 1 in 6, but now it's about 1 in 6, people will get more severe illness. And typically that illness is marked by difficulty breathing, because the virus has a tendency to cause a pneumonia, a viral pneumonia. It's often a bilateral pneumonia. And then the most severe disease is frequently in folks with risk factors. So as we get older, and so the elderly are a particular risk, people with underlying medical conditions like heart disease, lung disease, diabetes, high blood pressure are also at higher risk. So that's sort of the fundamentals of COVID-19.
Okay. So now we have a little bit better understanding of what it is. What are some things that we can do to prevent from the spreading of the virus?
All right, so it's important to understand how COVID is spread. It's spread by droplets, as opposed to aerosol, which diseases like measles and TB spread by aerosol, so that if you're in the same room, it can travel a long distance. But with droplets, it's really when we cough and sneeze that we tend to transmit. It's why you've heard about social distancing. Social distancing is that if someone is sick, you want to keep the 6-foot distance because it reduces the likelihood that with any coughing or sneezing or exhaling that the droplets will hit you.
Okay.
So, but the other important piece about droplets and COVID-19 is that those droplets can get on surfaces. Once they get on surfaces, they can live there for hours, and some experts think days. And what happens is we all are touching surfaces. And a very human trait is that we touch our face. So we touch our eyes, our nose, our mouth. And if you pick up droplets and then you touch your mucous membrane like that, that's when you can give yourself COVID-19. So those are the two key things that you want to understand about how we can get it. Now you asked about how to prevent it. Mm-hmm. So the key in prevention is, first of all, I talked about social distancing with the 6 feet when someone's sick. Secondly, what's really important is hand hygiene. So when I described to you this issue around we pick up the virus on our hands. So regular and thorough hand hygiene, in fact, kills the virus. It's why it's so critical in preventing spread. And hand hygiene can be using an alcohol-based sanitizer, which is very common, or even thorough washing with soap and water works fine as well. Okay. The other thing is, for folks who are sick, it's very important to use respiratory hygiene, which means if you're going to cough or sneeze, you do so into your sleeve. If you're going to use a Kleenex, then it's important to dispose of it right away, and then to clean your hands as soon as you can afterwards. So those are the fundamentals, the very basics that are the most important and well practiced to make a big difference.
Yeah. So before we went on, we were just talking about different countries and what they're going through. But if I present symptoms as a citizen, what is the best course of action if you're a Durham resident?
Okay, so the most important thing and the best thing for you to do is to in fact stay home and self-isolate.
Okay.
First of all, let me just remind everyone that as of today, COVID is really not penetrated Ontario very much. Mm-hmm. Most of the cases that, in fact, all the cases in Ontario that have happened, I think it's with the exception of one, has been transmitted by someone who came from a high risk zone. So it's still low risk, but the key is, and mostly what people will have still is our common viruses that circulate all the time. If you're ill, and then what you do is you self-isolate. If you actually have risk factors, so this requires screening. So if you have risk factors, you traveled from a high risk zone, you've been in contact with someone with COVID, or anything that feels like there's an exposure risk. That changes things, right? Because then what we want is folks to contact their healthcare provider, to interact with them, and then make sure that we go to the next step. So what happens is you would call your you can call telehealth. Ideally, you would call your primary care physician or nurse practitioner. You can also call public health, Durham Regional Public Health. And basically what they'll do is they'll go through a screening with you. Okay. And if in fact you do have the right risk factors, then the next step is from screening to an assessment. And the assessment is where there would be a decision made about whether you actually need testing with a swab. Okay.
So that would require you to come into a facility then? Or?
Right. So what's happening right now is an assessment clinic has been set up. It's centered. It's based out of the Oshawa Hospital to serve Durham. Okay. But we know that as things evolve, that we will end up with multiple centers, and including facilities outside of the hospital that can do more effective and rapid testing. Mm-hmm. So I defined for you what would happen when folks have mild symptoms. Mm-hmm. If your symptoms become severe, like if you get shortness of breath, you're feeling very unwell, then then what would be necessary is for you to visit your nearest emergency room. Mm-hmm. And where possible, it would be good if you could call ahead. You're telling them that you have risk factors. Now this is what needs to be in place and what we're building on currently. Mm-hmm. If in fact COVID basically starts to circulate regularly in the community, the approach will be the same for everybody. Yeah. But today this is the approach.
So to recap, the approach is self-isolation, call your local doctor that you deal with, Durham Regional Health, and then into potential emergency room and treatment would be the...
For people with severe illness, but yeah. for folks who have the mild illness but actually screen positive, yeah. It's still important to make the connection with your care providers, yeah. Because those folks, we still want to be able to assess and determine if they need testing. Okay. We want to know if COVID is in the community, including when it's affecting folks with mild disease.
Okay, perfect. We're just going to switch over to Stephanie with some questions here. So we have over 700 businesses in our membership. As an employer, what should the employer know about their rights in situations like this?
Right, so in situations like this, an employer's obligations will stem from the Occupational Health and Safety Act. That piece of legislation states that every employer does have a legal obligation to take every reasonable precaution given the circumstances in order to keep their workers safe. That of course extends to COVID-19, given that employers therefore have the obligation to try to prevent the virus from entering their workplace. Now, what that looks like for employers and for businesses in Durham Region really depends on the nature of the business itself. So if you're operating a company and there's quite a bit of face-to-face interaction between individuals, the measures that you're going to bring into the workplace obviously are going to be quite severe, quite forward compared to some other businesses. Now, that being said, regardless of your type of business, every company should have policies and a plan in place. If they don't already, then they should be implementing new plans and new policies as this sort of evolves. What those plans and policies are going to say is they're going to tell employees, first of all, how they're going to be protected, but also how business can continue on. it's important that this plan is put in writing and clearly communicated to employees, accessible to employees. Some of the things that an employer may want to consider putting into this policy or their plan is, first off, recommendations for the employees. So, not to travel by any means of public transportation, not to attend events that entail sort of large mass public gatherings. I think, working from home is an option for some employers that they should definitely explore. Limiting in-person meetings and maybe making teleconferencing, phone conferencing more available. Employers should also think about, reminding employees of their obligations to report if they feel they are at risk or have come into contact, identifying who in management in that workplace they should be reporting to, they should be communicating with. As well, reminding employees of what the employer's sick time, whether that be paid or unpaid, what their entitlements are in that area. And ultimately just maintaining as an employer that employees' safety is first and paramount in this situation. And I guess ultimately what's important for employers to keep in mind is that what may appear to be drastic today will not necessarily be drastic tomorrow. So it's always better to err on the side of caution, to be quite preventative rather than under-preventative.
Okay. And now go to the employee side. What should employees know about their rights? Okay.
Right. I mean, employees also have rights and responsibilities. So I think first off, they should be taking their lead from the plan and the policy that the employer's being, developing and putting in place, as well as the recommendations of the government and the health officials. So again, things like restricting travel, restricting interactions with other individuals. On the legal standpoint, under the Employment Standards Act, there's no official requirement for an employer to provide paid sick time to employees. An employer may already in place have a certain number of sick days that the employee could definitely apply if they're looking at a quarantine situation, but that's something that employees need to be aware of. And I think as well, it's important to sort of maintain a mindset that this shouldn't turn into an employer versus employee battle, right? We're all in this together.
Yeah.
So accommodations are going to be made on both the side of the employee and the employer, just to make sure, again, continuity of business for as long as possible, and also that employees are protected.
Okay. And I noticed over the last couple of weeks, the federal government made some announcements, streamlined some EI. Can you explain some of the changes the federal government put in place? Right.
Well, I mean, first I'll say that there's a lot of moving parts. This is an evolving situation.
Yeah.
So I do expect the government will probably have subsequent announcements to come regarding EI and compensation for individuals. What I can say is that typically EI benefits, someone who is entitled to EI benefits would have a 1-week waiting period before they receive those benefits. So if you're looking at a situation where you're being quarantined for 2 weeks, you're only receiving benefits for one of those weeks.
Yeah.
What the government has done is they've eliminated that 1-week waiting period. So employees who are quarantined for 2 weeks, or any individual who's quarantined for 2 weeks, they could be entitled to EI for that full amount of time.
Okay.
Again, I do anticipate there'll be further restrictions and nuances and information coming down the pipe.
Yes, it's very new.
Correct.
Are there any other areas in the employment law that we should be aware as employers, or anything you've heard or understand that employers and employees need to understand in the days moving forward?
Right. Well, I think it's important to keep in mind that all the current legislation we have in place that govern relationships between employers and employees, I mean, that is all still valid, right? So we've talked about the Occupational Health and Safety Act. We've talked about the Employment Standards Act. So everyone should be aware of their rights and responsibilities under those pieces of legislation. I think on a broader scale, we're in a very interesting time legally, because we don't have a lot of legal precedents to handle situations like this. We haven't been in situations like this very often. So it is, again, an evolving landscape, and what legal advice may be given today may change tomorrow and 2 days from now. So it's important for employees and employers alike just to be staying informed, staying up to date, and keeping those communication lines open.
Yeah, definitely. Dr. Stone, what have you seen at the hospitals and at Lakeridge Health over the last couple of weeks as COVID-19 has grown and increased?
Yeah, so the hospital's been really busy over the last 8 weeks with its pandemic preparedness planning. And I think it's coming along very well. We will be really embarking on a lot of training with staff starting Monday. But I think our plan is quite solid. We're fortunate that in Durham we haven't had to have any patient admissions to hospital with COVID-19 yet. I think everyone's aware we did have 2 cases in Durham, but both patients were assessed and were able to be discharged from the emerge for self-isolation at home for 14 days. So.
Awesome. And Stephanie, on your end, have you seen any increase in inquiries both from employers and employees at your law firm?
Absolutely, especially in the past couple days. Particularly on the employer side of things, I would say. We've had lots of calls from employers who ultimately want to know what their obligations are to their employees and how things will play out if a risk does come to their workplace. Ultimately, our advice has been uniform in the sense that every employer needs to be putting a plan into place. As I said, have policies, simple measures such as having a policy for each employee to wipe down their workstation at the end of each day. I mean, that applies to everyone. That being said, it is context specific depending on the type of business, the advice that you're going to get. But, yeah.
Oh, perfect, thank you. If we have any questions on live right now, which we don't, but if you do, please click in. Is there anything else you would want the community, the business community, and even just citizens to know from the hospital side or even from the legal side before we close out?
I think just a few things. I want to just reinforce the importance of hand hygiene, respiratory hygiene, appropriate social distancing when people are ill. I'd also wanted, from the point of view, this is a discussion for the Chamber of Commerce, is folks who are ill, it's important for them to exclude themselves from work. Many of us have a habit of toughing it out and going to work when we're ill. This is not a time for that sort of approach. So I think we want to reinforce that. I think everyone is seeing that COVID is not a virus that respects borders. It's traveling to the extent that it's appropriate for the business community to avoid international travel. We think that's wise. We expect to see much more of this in the coming weeks. And then for further information, there's some good websites. There's a good Q&A in the WHO website. Durham Regional Health Department also has information. And again, we talked about what to do if you're ill. The one number I didn't mention was if you have questions, just some questions, you can call Telehealth Ontario. Now I'm gonna have to double check my phone, but I think it's 1-866-797-0000.
Okay, and we'll post that number just so that everyone has it. So I appreciate it. Thank you. Do we have any questions?
We have 2 questions.
Yeah,
okay.
So we have 2 questions. The first question is from a company that's in the service industry that requires N95 masks for their mechanics to work with chemicals such as refrigerants. With the stop of selling of these masks, do you have any recommendations on where they can obtain them so that they can fulfill O, H, and S standards to their mechanics?
That's it.
You're asking me. So we have at the hospital. There's a procurement process which we activate with a number of other hospitals to purchase supplies like that. I will say that supplies like this are in short supply in the province. I don't have specific advice about how this is done in the business community, so I don't have that expertise to comment. It is a big issue, and clearly a big issue for employees in certain sectors where this is a requirement. So
yeah, it's definitely something we'll have to look into with because it's required within the job to do it. So I know there's a shortage across the board. We're in disaster recovery, our company, and it's required on job sites, and there's a shortage. So I think we're going to have to kind of go through those waters together and see how things change and see when supply comes in. But just this normal person is buying 10, 15, 20 masks off the shelf, where that wasn't happening a month ago. So
right. A lot of unanswered questions,
yeah,
right? And I think it's important to acknowledge that things are going to change, policies are going to be amended, laws are going to be amended. So again, just keeping updated and informed. And as Dr. Stone mentioned, there's a lot of great resources aside from the media with factual information. So the World Health Organization, and I know the Chamber, the Canadian Chamber, and as well as the Oshawa Chamber has put out some great resources.
Yeah, the Canadian Chamber, if you haven't been there, their webpage has some really good information of how to ready your business, and gives you kind of a lot of questions you should be asking yourself as an employer, and asking the questions to your employees to help you, maybe run your business, but also help navigate this situation right now. So do we have any other questions?
Yeah, so we have a few more. So I don't know if you're able to answer this, but someone asked, will ministry offices be closing, and will Employment Ontario offices in specific be closing?
Right, so I think everyone's taking it day by day, right? So we don't have a definitive answer on that at this time, but I'm sure announcements will be made.
Yeah, most likely the best route on a question like that would be to reach out to your local MPP to find out what's going on, because they'll have communication from the government on what's going there, and your local MP if it's a federal office. So because they're going to be getting communicated to. So.
Yeah, and we have one more. Someone wanted to know, are there isolation rooms at the hospital for those that get ill?
Absolutely. That's been part of our whole planning for, we call it pandemic surge planning. That's top of mind. So the way in which we have beds that are appropriate for folks with COVID-19 that can be appropriately isolated, whether it's a regular medicine ward bed or an ICU bed.
Okay. Any other questions?
No, that's about it.
Okay. Thank you for everyone for participating. Thank you very much for donating your time today. It means a lot for our business community. We'll keep everyone up to date on our social media and on our webpage as information comes in. If you have any other questions, please email the Chamber, and we'll see what we can do to answer them or help you navigate to the right parties to answer those questions. So thank you, and have a great weekend. I know it's hard to say, but please stay calm, and we'll get through this together.